Changing times, changing needs, helping your family member adjust to long-term care. A presentation for relatives of Holocaust survivors presented by Bikur Cholim, Guardians of the Sick, with a grant made possible from the JF&A Center for Advancing Holocaust Survivor Care. Welcome to this training. If you are here, it means you are caring for an aging Holocaust survivor, family member who is or will be in the process of adjusting to long-term care. I am confident that after this training, you will have an easier time caring for your family member. Let me tell you a little bit about myself. I'm a social worker, and I've been working with the elderly for the past 30 years. Most of those years I spent working in nursing homes. For the past 8 years, I have been working with a very special population, Holocaust survivors. As I've gotten to know them, it became evident that they are still suffering from trauma from the early years of their lives. As they age, the trauma intensifies and becomes more difficult for them to deal with. Trauma is a deeply distressing or disturbing experience. Let me explain how trauma affects people. Picture yourself crossing the street and suddenly a car comes barreling towards you at top speed. It doesn't look like the driver sees you or is going to slow down to stop himself from hitting you. What happens in that case is that your brain sees that you're in danger and it gets your body ready to react. What does your body do as it prepares to respond? Let's think about what that feels like. Your heart beats fast, your muscles become tense, your breathing is shallow, and every ounce of energy in your brain is super focused on every detail of what's going on around you. We describe this reaction as fight or flight. The brain has to decide whether you're going to defend yourself or run away. In the case of the car, you will most likely run away. After the threat passes, your body will probably return to normal. When someone goes through an ongoing trauma, like the Holocaust, their system goes into a constant state of fight or flight. Think about what that might be like. What makes it even worse is that there is no sign that this will ever end. It's one thing when you go to the doctor or dentist for something painful and you know it will be over in a few minutes. It's quite another thing when something terrible seems like it could go on forever and there is no end in sight. Many survivors suffer from post-traumatic stress disorder or PTSD. PTSD is an emotional condition that results from experiencing or witnessing a terrifying event. Someone with PTSD may experience nightmares, flashbacks, or intrusive thoughts that can interfere with their functioning. Effective treatment is an important part of overcoming PTSD, but many survivors have not received treatment for PTSD. Survivors of trauma do not have a sense of a safe and predictable world. They experienced such horrific situations by the hands of other human beings that they have a difficult time trusting others. People living with PTSD are sometimes not able to differentiate between the reality of today versus the reality of the past. They are fearful of many situations. For people going through an experience like the Holocaust, everything begins to look like a scary threat. It's overwhelming and exhausting, both physically and emotionally. Some of them can't ever feel safe and are always on the lookout for the next threat. Anything that reminds them of their experience may feel like a threat, and they may respond as if they're being threatened. These reminders of traumatic experiences are called triggers. Each survivor suffered major trauma during the Holocaust, and each survivor had their own experiences of survival. Most survivors had to bury the memories of their past and their trauma in order to begin new lives. The trauma was so severe that they couldn't even think about it, and the emotional pain was too much for them to deal with at the time. Many survivors began telling their stories as they got older. As they aged, survivors slow down and the memories resurface. When someone retires from a lifelong job or marries off their last child or slows down physically due to illness, they have more time to reflect. And this leads to them dealing with the awful memories of the war, accompanied by PTSD and trauma effects that may have never been addressed. Trauma affects each person differently. Traumatic experiences and the reactions to traumatic experiences are different for each and every person. There is no one-size-fits-all approach to trauma survivors. Different survivors may be triggered by different situations. Understanding that each individual is unique and each survivor had their own experience led to the development of PCTI, Person-Centered Trauma-Informed Care. The goal of PCTI is to individualize our approach and care for each individual based on their particular needs. You know the person you are caring for better than anyone else. PCTI takes it one step further. By understanding and recognizing the unique emotional sensitivities of your Holocaust survivor relative, you can better care for them. Accepting the need for long-term care can create a number of challenges for survivors. While all older adults may have a strong need to feel in control of their lives, this need may be especially deep for survivors who have experienced trauma and severe lack of control earlier in their lives. Adjusting to long-term care involves both concrete and abstract losses. A survivor moving into a long-term care facility may need to give up some of their possessions as they move into smaller quarters. Leaving a familiar environment for an unfamiliar one is also a loss and can bring back memories of being forced to leave their homes and communities during the war. Getting older and losing your ability to do things is difficult and painful for anyone, but physical weakness and illness can actually be triggering for a survivor. During the war years, and especially in concentration camps, any sign of physical weakness led to separation from their families and to certain death. These survivors witnessed this many times over and over again. The very reality of growing old may trigger fears and anxieties among survivors for these reasons. In fact, it's important to be aware that a survivor may not be totally honest with you about their physical symptoms and may even be suffering more than you realize. Anyone dealing with physical deterioration, a debilitating disease, or decreased mental capacity will have a difficult time adjusting. Getting used to having less control over their decisions and daily routine is challenging for anyone. It is even more difficult for survivors who have suffered in the past when the Nazis controlled their lives down to the smallest detail. It's important for you as a caregiver to be aware of how painful this is for a survivor, especially having to readjust after living independently for so many years. Entering a setting where a group of elderly people live can highlight the survivor's own experience of aging. As the survivor is surrounded by people with various levels of physical and cognitive loss, they may be forced to reflect on their own aging process and their fears for the future. Challenges that survivors face with regard to eating and sleeping can be especially difficult when a survivor enters a long-term care setting while others are making the rules. How to raise the topic of full-time care with the survivor. Even in families where communication is comfortable and elderly relatives are realistic about their needs, the need for long-term care is an uncomfortable topic. It may feel impossible to think about, much less discuss, particularly if your relative is opposed to the idea. As a result, unfortunately, decisions about placement in a long-term care facility are often made in reaction to a crisis, such as discharge from an acute care hospital. It's much better to start thinking about the possibility and exploring your options before a crisis occurs. When possible, take time to plan a strategy for bringing up the topic. That strategy can include involving a trusted doctor, a relative, or a friend who has a good relationship with the survivor and is someone he or she may have an easier time listening to for advice. If a survivor relative needs full-time assistance at home or in a nursing home, be there as much as you can at the beginning. Spend time with the survivor and the aide so the survivor can see you interacting with the aide and will begin to view the aide as someone they can trust. Different family members can help in different ways. When a survivor resists care or medical attention, it may take several attempts to get them to agree to it. Unless it's an emergency situation, take the time to explain it to them. Enlist a doctor who they trust and whom they know for a long time. Choose a family member that the survivor relies on for advice whenever possible. Identify in your family who the survivor listens to most. This may not be the regular caregiving family member. In each family, different family members may have different roles in caring for the survivor relative. One family member may be the physical caregiver. Another may be in charge of medical appointments and contact with the doctors, while another family member may be handling the finances and bill paying. Identify the strengths and availability of each family member so that you can all work together to care for the aging survivor. Ideally, the survivor and all family members will be on the same page regarding the decision to move to long-term care. Unfortunately, it doesn't always happen that way. As long as the older adult is mentally competent and capable of making their own decisions about their medical care and living arrangements, they should be empowered to do so, even if the relatives disagree with their choices. However, it is up to the family members and medical professionals involved in the care of the survivor to make sure the survivor is safe and cared for in the proper situation for his needs. If at all possible, plan in advance for the move to long-term care. Planning creates the possibility for the older person to be part of the decision and to prepare themselves psychologically for the transition, as opposed to making the move directly after a fall or hospitalization. A planned relocation will be easier for the survivor to adjust to, in contrast to an abrupt and traumatic wrenching from his home that may remind the survivor of what they may have experienced in the past. Create a comfortable environment for your survivor relative. Having the opportunity to familiarize himself with the facility in advance can help a survivor feel less anxious about the transition. It's ideal if the facility staff has an awareness of the needs of survivors, as well as being able to provide Jewish programming and being able to accommodate Jewish holiday and dietary needs. Anything you can do to create an environment that's comfortable for the survivor, including placing photos and personal items in the survivor's room before they are admitted, can facilitate a more comfortable adjustment. Educate the staff about your relative. To help the staff provide the most sensitive care, you can share your relative's family history and personal achievements and stories. Try to capture, validate, and remember the core of their personality, their lifelong struggles, and their accomplishments. The more the facility can appreciate your survivor relative as a person, the easier it will be for them to treat your relative with kindness and compassion. Families should take the time to educate the nurses, doctors, and other care providers about an elderly relative and their circumstances. This will go a long way toward ensuring better and more sensitive care. As much as possible, become part of the care team. Work closely with the staff, advocate for your relative, and provide as much physical and emotional support as you can. There are many different experiences in an institutional setting such as a rehab, which may trigger strong emotional responses in survivors of trauma. Just being admitted to an institutional setting such as a hospital or a rehab may trigger painful memories. Holocaust survivors and trauma victims are often frightened of new faces and new experiences. Uniforms can be particularly triggering for survivors as reminders of the Nazis who abused and terrified them during the Holocaust. Medical staff in uniforms, loss of independence, being on a schedule not of their own choosing, being dressed or showered by a stranger, and many more changes. These are all major challenges for anyone, but it is even more difficult for Holocaust survivors to adjust. Some triggers are common to many survivors: showering, new and unfamiliar faces, staff in uniforms, loud noises like fire alarms, or scary-looking medical and rehab equipment. These and other everyday aspects of facility life can be frightening for a survivor. As a family member, make the staff aware of this beforehand, and that can help them plan how to help the survivor to adjust through these experiences. Eating and sleeping present particular difficulties for survivors. Many Holocaust survivors tend to hoard food, not to eat their full meal, and always save some food for later. During the war, food was rationed and there was always a shortage of food. Whatever rations they received during the Holocaust, they always saved some for later, not knowing when their next meal would be. In their own home, this tendency may cause minimal difficulty, but in a long-term care setting, it can pose a problem. Sleeping is also a challenge for many survivors. They suffer from nightmares and flashbacks, and this may lead to a fear of sleeping. They don't sleep well at night and frequently nap during the day. This can create some difficulty for a survivor in an institutional setting where they may be disturbing a roommate. By planning ahead, you can reduce the stress for the survivor and for yourself. Whenever you can, prepare in advance. It will make caring for your relative easier and a more pleasant and less stressful experience for yourself and your relative. Always remember that you are not alone in caring for your survivor relative. You are part of an important team of patient, family, medical professionals, mental health professionals, and religious counsel. Don't hesitate to reach for help when you need it. Find creative ways to overcome challenges. When it comes to planning for expected triggers or dealing with unexpected ones, always think out of the box. When you are confronted with a brick wall, there is always a way around it. You can climb over the wall, you can go around it, you can chisel your way through, or you can dig under it. Where there is a will, there is a way. When you focus on problem solving, you will come up with creative solutions. Just don't give up and don't be embarrassed to ask for help. Distraction can also help when the survivor is confronted with a trigger. Focus on the person and what is causing them to be anxious or fearful at the moment. Try to distract them or change gears and come back to the situation later or a different day when possible. Information will go a long way in preventing stress. Take the time to explain things before it happens. You may have to simplify the details or tailor it to the needs of your survivor relative, but tell them where you are taking them and for what purpose. For example, if you are going to a doctor's office or medical setting, remind them what medical issue needs to be addressed. You can assure them that you will be with them the whole time. You will need to prepare them for any intrusive procedures or tests while explaining the need for them. I have talked a lot about the survivor and their needs. Now let's talk about you. The decision to move your relative to a long-term care setting is difficult for them, but no less so for you. This transition can be particularly difficult for children of Holocaust survivors. Children of survivors often feel a tremendous responsibility for their parents, which can complicate the decision to move them to long-term care. It's important not to see this decision as a failure. Many times, it's the only option. When this is the case, know that you are supporting your parent or relative to the best of your ability. That is all any child or caring relative can do. It's important to remember to care for yourself during this challenging time. As a caregiver, your focus is on the aging survivor, but an important thing to remember is to take breaks and care for yourself as well. If you are feeling overwhelmed or not feeling well, you won't be an effective caregiver. Self-care is very important. An example I like to give is the oxygen mask on the airplane. Before each flight, the stewardesses demonstrate how to put on the oxygen mask in case of decreased air pressure in the cabin on the plane. Do you know who they instruct you to put the mask on first? You or the person sitting next to you. Always put the oxygen mask on yourself first, even if it is your infant child or your elderly mother sitting next to you. Do you know why? If you don't put the oxygen mask on yourself first, you may become weakened and not able to help the person next to you. By putting the mask on yourself, you will then have enough oxygen and energy to help those around you. It's the same with self-care. Take care of yourself first so you can be there for the person that you are caring for. As a caregiver, remember to care for yourself first. You need proper sleep, nutrition, and exercise, as well as free time to enjoy your favorite activities. This will enable you to be healthy, strong, and refreshed so that you can have the right frame of mind to be a patient and caring caregiver. Caregiving is emotionally draining. Don't keep things bottled up. Find someone you can talk to, whether a family member, a friend, or a professional. Caregiver support groups are a good source of emotional support. Contact your local social service agency to find one in your area. You need the emotional support in order to be an effective caregiver and not to burn out. Even once your relative is admitted to a long-term care facility, you are still considered a caregiver. You will be visiting them and continue to be involved in their care together with the staff of the facility and other family members. Schedule some relief time for yourself by arranging a backup visitor for when you are unavailable or just need some time for yourself. And give yourself a pat on the back for all the things you are doing to care for your family member. It could be the most challenging and most rewarding experience all at the same time. As challenging as it can be to care for your survivor relative, it can deepen your relationship. Knowing that you are needed and are important to your relative, even if they don't express that to you, can be a source of comfort and satisfaction. Together with the emotional pain of seeing your relative's abilities begin to fade is the comfort of knowing that you are there for them in their time of need and an important part of their quality of life as they age. And now I'll take questions.